New tonight, reducing multiple surgeries for patients with traumatic brain injuries.
That is the goal of a new medical trial just released involving a Toledo doctor and patient. 13 Action News reporter J.D. Pooley has the details.
A Toledo patient was part of a clinical trial treating brain bleeds with the goal of avoiding repeat surgeries.
Shutting down this blood vessel with a medical glue can actually result in reducing the risk of reaccumulation of blood, or the blood becoming more significant to the point where it would require a second surgical evacuation.
Dr. Mohammed Juma, a neurointerventionist at ProMedica, says a recent study that explored treatment for brain bleeds that could lead to a stroke will have lasting effects locally and around the world.
The leakage of blood immediately below the covering that protects the brain from the outside.
The trial, which involved a local Toledo patient, tested whether a brain bleed is less likely to require additional surgery if a substance is injected to block or embolize one of the arteries supplying blood to the dura or protective sac around the brain after a traumatic event.
Patients usually present with headache. They can have weakness on the opposite side. They can have vision changes. They can have difficulty with speech. So they're all symptoms from the brain getting irritated by this blood immediately above the brain underneath the covering that protects the brain from the outside.
Dr. Juma says the findings of the study show that patients are less likely to have repeated surgeries after the injection.
So the surgeon would go in, drill a hole in the skull and go in and drain the blood. The goal of this is to actually prevent surgery altogether if possible.
Dr. Juma is hopeful that the new trial will become part of his practice in the next few weeks.
But anytime you have a major breakthrough treatment like this one, that's usually huge for our field.
In Toledo, J.D. Pooley, 13 Action News.